Are we there? We start. Okay, good evening everyone, and welcome to our live today. It's exactly 10 minutes past 7. Exactly 10 minutes past 7, and it's 17th of November 2023, Thursday. So today we are starting our live. But before I start this live, I would like to inform all those people who are booking appointments on our through the YouTube, booking appointments on our website. Please, when you're writing your number, make sure that you put the WhatsApp number. Make sure that you fill in the WhatsApp number, because some of you they schedule to talk to me, and then it's not possible for us to talk because you've not put a WhatsApp number, and some of you do not put. Some of you don't put the country code, so at the end of the day, your appointment doesn't pass through when you've even paid. So make sure that when you're booking your appointment, you put your WhatsApp number, because it's your WhatsApp number that we use to get connected. So this is very, very important who are trying to book appointments. All right, so thank you so much. Let's start straight away with question number 1, and today we are only answering questions. We are only answering questions from our viewers. Like I've already said, I don't bring topics of my own. I only want to answer questions you raise. So straight away, let's start with question number 1 on YouTube. And this is Agatha Okoli saying, hi doctor. Everyone is just greeting me for now. And okay, this is the first question. In Iota, Emmanuel, I want my second child to be a female, sir. All right, all the best. We wish you all the best. We wish you all the best so that your first child can be female. Then we have all these ones are just greeting me. Hi to those people watching from Namibia. I see a lot of Namibians here on YouTube. Hello everyone, USA, Nigeria, Zambia. Many of you are watching. Thank you for watching. Where is here? They are all from Zambia, Namibia, Nigeria, USA. Okay, so let's get to this first question. All of you are just telling me where you are, and say hi to all those people there. So Omoledi Oyawoye is the first person to ask the question. Doctor, I am 42, all right, you're 42. I had fibroid surgery in 2021. After the operation, I did first menses, but later I didn't see my menses again, and I want to conceive. So Omoledi Ogowaye, where are you? First of all, where are you? Which country are you? But if you're 42 years, you had fibroid surgery and you're no longer seeing your periods. Now, there are two things involved there. Number one, first of all, when you have a fibroid, if you have a fibroid, it means the levels of estrogen in your blood are high. So when the levels of estrogen in your blood are high, they will neutralize or they lower down. They will cause a negative feedback on the levels of progesterone. So when the levels of progesterone go low, that means you're going to be having problems with menses. And those are people who have issues of no periods. That is issue number 1. Issue number 2 is that at 42 years, you're diminishing. There is diminished ovarian reserve. The levels of your the ovaries, okay, the quality and the quantity of your ovaries slows down. So when the quantity and the quality of your ovaries of your ova slow down, it means that you're going to be having still problems with menstruation. And therefore, even during fibroid surgery, sometimes there can be damage. I'm not saying that there was damage to your reproductive system, but there can be damage to the uterus, there can be damage to the ovaries, whatever. So that can also cause the issue. So now, what do I tell you, or what you're supposed to do is, number 1, to go and carry out a pelvic ultrasound scan. Go and do a scan. That scan will be able to visualize, a scan will be able to look at the structures, okay? First of all, to find out if you no longer have any fibroid. Okay, you need to first find out if you no longer have any fibroid. If you still have a fibroid, then we find out what to do. Then 2, you're also supposed to do your fertility hormonal assay to look at the levels of your hormones. And don't forget to do AMH levels. When you do AMH levels, we shall know whether you still have eggs, or we shall be able to determine your ovarian reserve. I think that question is done. Missy, who asked the question? Okay, so I think that question is done. I'm failing to get your name, but I think that question is done. Let's go to question number 2. And question number 2 is coming from Patrish Koma, watching from Malawi. All right, say hi to the Malawians. Ngozi Okoye, doctor, I saw my menses on 30th October and I'm seeing it again on 16th November. What can be the problem? You saw menses on 30th of October and you're seeing them again on 16th. That is just a difference of around 16 or 17 days. So that is an abnormal menstrual cycle. The problem could be that, one, you are using a family planning method, a hormonal method of family planning. E.g., you're using an implant, you're using an injection, Depo-Provera, or you took emergency contraceptive pills. That is one of the reasons as to why you may be having short periods or irregular menses. Then number 2, you may be having a problem with your hormones, especially progesterone levels or prolactin levels. So check around that. That's where the problem may be. Right, so let's have another question. This is Blessing Ebiri saying, did the ovulation come twice in a month? Because sometimes I use to see my menstrual cycle twice. Ovulation can come twice in a month. It is possible. Twice in a calendar month, not in a menstrual month. A menstrual month. So it's possible for you to have ovulation twice in a menstrual month, but not in, in a calendar month, but not in a menstrual month. I think you understand that. Then we have a question from Ngozi Okoye. All right, this one is answered. Gladys Mbanda is saying, Doctor, Doc, can someone with tubal ligation conceive again? Wow. If you had tubal ligation, you can only conceive when the tubes have been, when anastomosis has been done. You know what happens? This is what happens, okay? This is what happens during tubal ligation. Tubal ligation is a procedure whereby you go to the hospital and you request the doctor to tie your fallopian tubes, okay? You request the doctor to tie your fallopian tubes. And this is what is going to happen. This is what will happen. So this is what happens. During tubal ligation, the doctor ties here, okay? You enter the abdomen and then tie here. You tie here, okay? This is tubal ligation or TL. So you tie here. After tying, you cut. That means you have separated virtually the fallopian. In other words, you've broken the fallopian tubes. You've made two particles or two parts of the fallopian tube. In other words, you have two pieces of the fallopian tube. So there is a disunion between the fallopian tubes. Now, what is supposed to be done if you had tubal ligation? What is supposed to be done? If you go to the hospital, this part can be brought back to the stump and then anastomosis is done. So when you do surgery, these things can be put back and then that person can be able to conceive. So if you had a tubal ligation, it is possible for you to conceive. However, a procedure has to first be done. Which procedure is that? It's a surgery which is done and then tubes are put back. Okay, they are anastomosed. Okay, one part, in other words, you anastomose the tubes, you tie the tubes back together, and then there will be a chance of you conceiving. I hope you're getting me. Then we have another question. Tameji, also on YouTube, you're saying Tameji Zimba is saying, I have polycystic ovarian syndrome, and I was on Inositol. All right, this is a good drug, and Maca root was prescribed. Clomid last menstrual, which I drank. Can I conceive on first try of Clomid? Because my HB comes for a month every 4 months. Yes, first of all, you're lucky that you're taking a good drug. Okay, Inositol is a good drug. It's a good drug for polycystic ovarian syndrome, and it's possible. By the way, some people even Some people can conceive on the first trial. Yeah, it's possible. Someone can conceive on the first trial, though most of you will conceive on the second trial. So it's very, very possible. Then DM, you're saying, Doctor, I'm turning 46 November 20, I'm turning 46 November 22 this year. November 22nd this year, you're turning 46, okay? Have tried conceiving last year, November, and even last month, not successful. My periods were missing from April to 28th September. Advise me. Oh, your question is running away. Sorry. Let me read it again. Sorry. It's running away. Okay. 28th September. Advise me. Had fibroids, but just shrinked. Okay. So now, first of all, you should know that the age is now advanced. You have an advanced age, okay? And with an advanced age of 46 years, it means your ovarian reserve is going down. You're having low ovarian reserve or poor ovarian reserve, okay? So that is one factor which may stop you from conceiving. The second factor is that you had fibroids. Yes, you might have shrunk the fibroids, but they are not completely off, okay? You might have shrunk the fibroids, but they are not completely off. So that could be a very big factor for you to conceive. Now, what I would advise is, number one, to first confirm whether there is no more fibroid. Yes, you shrunk it, but confirm that there is no more fibroid, that all the lesions are gone and you don't have fibroids. An ultrasound scan, you need to first confirm that you don't have a fibroid. That is number one. Then number two, I would request you to check on your AMH levels, because at this level we expect a diminished ovarian reserve. We need to know whether you still have enough eggs or not. Okay, so you do an AMH test and all other tests to find out what the problem could be. But what I can say is that you can conceive as long as you've done tests and we know what you've done. All right, so how are you? Where are you calling from, and what's your question? Kale nyawe nawe jebaleko. Please try to speak English. My audience is English. Please try to speak English, because I have an English audience and they want to all listen to the question. Yes, I understand the language, but please speak English because of my audience. The scar? Okay.
From outside.
All right. So you had the cesarean section. You had the cesarean section last year, and right now there is swelling of the scar. Yeah, so that happens, and that we call that scars happen, and some people, even when it is not a cesarean section, someone can have a simple mini operation or a simple injury on the body, and there is formation of scars, or scar formation. I think you've also seen these things of keloids. You've seen women who have pierced their ears, and then they end up with some big stuffs on their ears, and those are called keloids. So those are the same things. Yes, there is an injection which can be given. People can be given a steroid injection called triamcinolone K. If the scar is big, okay, if the scar is big, you can use an injection called triamcinolone K, and that injection is injected directly into the scar, into the tissues. If the scar is not all that big, you can use some creams. There are some creams that can take away the scars, like no scar. Many creams can be used. But if the scar is big, you have to use a steroid drug called triamcinolone K.
So, doctor, can you please help me with your number? Because the network is not so good. Some words are not coming out so well.
I'm saying you're supposed to use triamcinolone K. I'm sorry I don't give out my number, because when I give it out, there are very many people that will be calling me and I will not be able to work. And if I give you my WhatsApp, you'll fill my WhatsApp with message. Huh?
Your hospital, where is it?
It's in Masaka Bikoff Medical Center. in Masaka.
No, that's too far. I'm saying my daughter is in Muturu. Can I inbox you, please?
No, you can't. There are many inboxes. I just end up not receiving any because there are very many. If I decide to read people's inboxes, if I decide to give people my number and I start receiving calls, the whole day I will be just receiving calls, and yet I have to be working on my patients. So, but in case you need if you want to have a private chat, go to the website and book an appointment. It's called www.druthman.com. You'll book an appointment, then you'll have a one-on-one with me.
Okay, thank you so much.
All right, welcome. But the injection I've told you, it's called triamcinolone K. Triamcinolone K. TRIA. Triamcinolone K. K, letter K, like a keto. Triamcinolone K.
Let me write it quickly.
Okay, very fast. I want to go to the next question. So on YouTube, we have another question.
Thank you so much.
You've gotten it?
I'm going to research it on Google, then I write it down.
All right.
Okay.
All right. So Nabite Peace, this is on YouTube. You're saying, Doctor, I want a male child and my menses are 25 days. Okay. All right. This is very good. You know, I like people who ask questions and it is easy for me to answer. When you give me the details of your menses, I can really very well calculate for you. So if you want a male child and you have is saying 25 days cycle, this is easy for me. This is easy for me. It's as easy as eating my best dish. My best dish is matoke and goat's meat. So it's as easy as eating goat's meat with matoke. So the question is, you have a 25-day cycle, 25 days. So if you have a 25-day cycle and you want to calculate the length, your ovulation, you want to have a male child, this is what you're going to do. First of all, let's calculate the ovulation day. So with a 25-day cycle, those of you who know, it will be 25 minus 18. What's the answer? Give me the answer here. 25 minus 18, what do you get? Very fast. 25 minus 18, what do you get? All right, people already giving me the answers on YouTube here. So it's 7. So 25 minus 18 is 7. And then if we get 7 plus 4, what do we get? 7 plus 4. Give me the answers, please. Okay, thank you. You get 11. So what about 11 plus 5? What do you get? 11 plus 5, give me the answers. All right, that is 16. So what does it mean? Your fertile days begin on the 7th day and end on the 16th day. All these ones are safe days. These ones are safe days. I think I'm talking like this because I know you understand. So what is the ovulation day? 11th day. Now what are you going to do? Miss Nabite Peace. If you want to have a male child, make sure that you sleep with your husband on the 11th day of your menstrual cycle. On the 11th day of your menstrual cycle will be the ovulation day, and that is the day you can have a male child. So what are you going to do? Now this is what you are supposed to do. When you see your periods like this, that is day 1. Take it as day 1. Then on the 11th day, you see periods like today, that is day 1. 1, 2, 3, 4, 11th day, have sex. Make sure that you're not having sex days before the ovulation. Don't have sex on the 7th day up to the 10th day. Just have sex once on the 11th day. You'll be able to conceive a boy child, because that will be a very you have very high chances of producing a baby boy or conceiving a baby boy if you have sex on that ovulation day, which will be the 11th day. So whoever has a 25-day cycle and wants to conceive a baby boy, of course, I now know that you know what to do. Then this one is saying, Doctor, I am 46. Oh, this is another question. I answered you. Okay. Vivi, a couple, is saying, Hi Beyonce, I am 4th Tomago, Togo Republic. All right, sorry, Vivi couple, I don't understand French. This looks to be French. I don't speak French. Please ask your question in English. Miss or Mr. Vivi a couple, ask in English. I only speak English on my channel. Though I may be understanding some other languages, but we only use English on our channel for the interest of everyone. So another one is create the life you love, is saying, Doc, I love your videos so much. Thank you so much for loving them. Thank you for answering questions earlier, so helpful. All right. Sahara